Today we celebrate the life and legacy of Dr. Martin Luther King Jr. It's a celebration of equity, diversity, and inclusion. And as we celebrate, we're reminded that this work that he started, that we need to continue. We at the Health and Environmental Equity Committee of the NAACP, in partnership with the Healthy Alliances Matter and other collaborators and partners, over this last fall, conducted a needs assessment of the African heritage community looking at the impact of COVID-19. And so we'd like to share our findings and have more conversation around that with members of the African heritage community. And so we invite you to attend a virtual town hall that we will be hosting on Wednesday, January 27, 2021. It will be from 5 p.m. to 6:30 p.m. We hope that you're going to be able to join us. This is specifically for the African heritage community members. We have the information on the screen, and we will have it out through different social media platforms. But you can also check out the NAACP website and the Healthy Alliances Matter website for more information. We'd also like to share with you what we have started to do based off of this work. We have the Mascot Backup campaign that was recently launched, and we are so glad that our youth and young adults have been so engaged in this work around prevention of COVID-19. We will be having a wider dissemination later for members of the general public and other stakeholders, especially in the healthcare industry, and that will be in February the 5th, a Friday. And so we will put out that information with time, and you'll also be able to find that information at our website. We'd like to encourage you to continue to engage in preventive behaviors, continue to social distance. I would say physically distance, engage socially so that you can maintain your mental health and well-being, continue to wear your mask, continue to wash your hands, and continue to just maintain sanitary conditions. A lot of people had questions around the vaccines that have come out, and there is a lot of hesitancy. So I sat down to have some conversation with a couple of my peers in the medical space. So we're going to be showing you a couple of clips from those conversations. Take a listen and do continue to stay safe. So I've been having conversations with members of the community and hearing just different perspectives about vaccines. And I wonder if you could shed some light on really how vaccines work.
Yeah, absolutely. The way a vaccine works is that it basically gives our bodies an opportunity to be exposed to a potential pathogen, something that could make us sick in very small doses, allows our body to become educated or learn how to deal with that. And then it protects our bodies by producing what's called an antibody that then protects us from getting infected later by that same microorganism or that same pathogen. The best analogy for that is basically getting a cheat sheet for an exam. So if you get the answers ahead of time, you already know what you need to do when you see that exam a second time. And the vaccines that we're looking at right now are introducing into the human body a very small part of the virus and allowing our bodies to become protected naturally by responding to that.
So what would you say to those who right now are skeptical, because they do have reason to be? What are your thoughts about it? What would you say to them really?
I would say that this vaccine is done in the light. We know that these other things that I alluded to beforehand were done in the dark. We had to bring them to the light. Even the Henrietta Lacks with the genome for cervical cancer and so forth, these all had to be uncovered. Once we knew that there was a SARS-CoV-19 virus, that basically a vaccine was being worked on. So this was not done in the dark. So that's the first reason we should at least have some reassurance that this is above board. Number two, we know that the trials were not done solely on people of color. They were done in a broad-based community and sampling pool of willing subjects. So, and it's also been touted by our politicians. So anytime you hear politicians willing to take something, then you can pretty much be sure that it's not under the cover of darkness in terms of being something bad for us. But the main reason we as African heritage people need to take the vaccine is simply what our former President Obama says: when white America catches a cold, Black America gets pneumonia. And so we know that because of our predisposition to pre-existing factors such as obesity, hypertension, cardiac disease, sickle cell, cancer, that we are more likely to not only contract COVID-19, but also to have more serious morbidities and, in fact, mortality. So, just for our health, we need to consider seriously in mass taking this vaccine. The second reason we need to take the vaccine is basically because of income. We know that the majority of African heritage people are essential workers, whether it's in retail, whether it's in fast food restaurants, whether it is in healthcare as medical assistants and orderlies and so forth. We have to go to work. And so if we get the vaccine, we're more likely to be able to be employed consistently and healthy. We need the money. Black businesses are the most likely not to reopen because of the lack of income and being closed down. So the more quickly we can get up to snuff in terms of getting a vaccine and getting people with some form of herd immunity and vaccination, we can reopen our businesses safely. The third is education. Our children already have an educational gap. We are less likely to have access to the internet for homeschooling. We don't have tutors, and we have parents that aren't able to sit at home and oversee our children's homework. So we do need to get the vaccine so that our kids can go back to school, so that if they return home to multi-generational families, that they're not infecting the grandmothers and the great aunts and their parents who are in the home. Another reason we should get the vaccine is psychologically. Sitting around in fear, not knowing if you're going to be infected, if you're going to die, if someone that you love is going to be sick and affected, is damaging. So for our communities, we need to basically take the vaccine for our psychological well-being. And then lastly, which may not be as serious, but certainly can be a motivating factor for our younger African heritage people, get the vaccine so that you can return to your social life. I know you want to go to the clubs, you want to go to parties, you want to go to family gatherings, our churches, our cultural events. Getting the vaccine will get us back into a social milieu that will benefit everybody. So those are just a few of the reasons I think that we should seriously consider when it comes to getting the vaccine.